Good morning. This is Dr. Tariq. Today, my topic is blood. Blood is composed of two components, liquid and formed elements. 55% is liquid, that is plasma, and 45% are formed elements, that are red blood cell, white blood cell, and platelets. An adult has 5 to 6 liters of blood in his body according to the body's structure. There are two types of cell in the blood. One is red blood cell and number two is white blood cell. These are the two main cells. Regarding red blood cell, it contains a pigment which is known as hemoglobin. The color of the hemoglobin is red, that's why it looks red. Its quantity is 4.7 to 6.1 million per cubic millimeter of blood in male, and in female 4.2 to 5.4 millions per cubic millimeter. Its lifespan is 120 days. Its job is to carry oxygen in the blood. When it is 120 days old, it is removed or destroyed by the macrophages in the liver and spleen. How they know? When our RBCs are 120 days old, they de-shape themselves and they decolored. Color is fainted and they lose their normal shape. It's a donut shape structure, thin in the center and thick on the periphery like the tire of a car. But there is no hole in it. Number two important cell or major cell is white cell. The technical name for white cell is a leukocyte. Its count is 4,500 to 11,000 per millimeter cube. It is of two types, granulocyte and agranulocyte. Granulocytes are those who have granules in their cytoplasm, like this. And agranulocytes are those who do not have granules in their cytoplasm. No granules and granules. Granulocytes are three types: Neb, neutrophil, eosinophil, and basophil. And agranulocytes are two types: Neb-Lem, lymphocyte and monocyte. So Neb-Lem, remember Neb-Lem. Neb are granulocyte and Lem are agranulocyte. Neutrophil, this is major neutrophil, this is major white blood cell. This is present in abundance. Normally it is 40 to 60% of the white blood cell. It fights with the bacteria, that's why in bacterial infection it increases in numbers. Number two is eosinophil. Normally it is 1 to 4% of the total RBC. It increases in case of allergies, bronchial asthma, eczema, and itching, dermatitis. Same is basophil. It also increases in allergic condition. Normally it is 0.5 to 1% of the total RBCs, but it increases in the allergic reactions. Number two is agranulocyte. Cells they do not possess granulocyte in their cytoplasm. Number one is lymphocytes. Normally it is 20 to 40% of the total RBCs, but it fights with the viruses. So in viral infection, its number increases. Lastly, monocytes are 2 to 8% of the total RBCs. Their increase in number indicates that there is some chronic infection. It is very important now, to number third is thrombocyte. Thrombocytes or platelets. They are very small. Some people say they are not cells. They are fragments of the cell of a big cell that is known as megakaryocyte. Their job is to clot the blood. Once the these cells are irritated, they become sticky and they make a plug at the site of the bleeding. This way it stops the bleeding, and that's why its name is thrombocyte. One thing is very important to understand, that is difference between plasma and serum. These both are liquid part of the blood. If liquid part contains clotting factors, it is known as plasma. So plasma is a liquid part of the blood along with clotting factors. And serum is liquid part of the blood without clotting factors. So serum is only liquid part, no clotting factor. And plasma is liquid part plus clotting factors. This is all about blood and blood cells. Thank you very much.